So welcome everybody to today's Be Well talk on managing scan anxiety. First, let me start by introducing myself if we haven't met. I am the manager of financial and workplace programs at Wellspring, and in that capacity, I lead the Money Matters, Returning to Work and Wellness at Work programs. I'm also one of Wellspring's trained brain fog program leaders. I have been with Wellspring since 2008, so quite a long time. It's a phenomenal organization to work with. And in terms of my background, I'm a social worker. So let's get started. And I like to start by letting people know that if you are somebody that experiences anxiety related to getting scans, you are not alone. In fact, years ago in 2011 in Time magazine, somebody first came up with the term scansiety. Really talking about anxiety related to scans. And it was a patient. And as you can see, I think this is a very relatable quote on the screen. As my scans approach, I become increasingly wary and deliberate in my actions. I put off major decisions until I hear the results. My breathing gets tighter, and those regular drives to the clinic are among the most tense I have. So again, I think that probably everybody that is on with us today understands this quote, has similar feelings. And so we're going to talk about that a little bit more today. So just getting to the basics, what is scan anxiety, or scansiety as it's often called? So it's recognized as the stress or the worry that you may experience either before, during a scan, or after a scan, while you wait for the results. And it can be related to a scan at any stage of your cancer journey. So it can be a screening scan, it can be a biopsy that diagnoses you, or that stages your cancer. And then also what causes anxiety are scans that you may have in a follow-up capacity. So to monitor your cancer for recurrence or progression. Recently, a group of researchers reviewed all of the literature that's out there on scan-associated anxiety because they really wanted to better understand it, because when we can better understand something, we can help and find solutions to it. And one thing that they focused on in their review was what elements of the scan experience itself were anxiety provoking. And not surprisingly, what was found is that there are multiple concerns relating to scans that are reported by cancer patients, and they may differ from person to person. And the scans fall into two categories. The first category, as you'll see at the top of the screen, is the scan results themselves. Understandably, there is uncertainty and fear associated in terms of what the results will show and the implications for disease status and treatment. Undergoing scans is triggering. It's a reminder of your initial diagnosis, and it can promote fear of recurrence. Some people worry about the scan procedures themselves. Often they may involve unfamiliar equipment, unfamiliar procedures. If you're claustrophobic, perhaps being in an MRI machine is something that's difficult for you. So again, you may be able to pinpoint, what your particular concerns are about the scans, and it may be in multiple areas. So when we're feeling stressed about something, that's a normal response. It's part of our fight and flight response, which helps us deal with dangerous situations, as well as sort of our more, regular day-to-day stressors. But, our day-to-day stressors in our lives come and go. Or we find effective ways to deal with them. But the problem with anxiety related to scans is there's not much we can do in terms of the source of the anxiety. It's something we don't have control over. You need the scan, you have the appointment for the scan, you need to wait for the results. Again, all things we don't have control over, which can be anxiety provoking. And given that we can't do anything about the source of our stress or anxiety, that means we have to find coping skills to deal with that anxiety. And that's what we're going to look at today. So I like to look at 5 different categories of coping skills. The first one is the actual acknowledgement of the anxiety and the stress that you feel in connection with having a scan or waiting for the results. The second is the more standard stress management techniques and finding what works for you. Number 3 is an interesting approach where we schedule our worry time. Number 4 is the importance of being informed and prepared. And then lastly, support. So let's focus in on the first one, and that is acknowledging the anxiety. This very first strategy really comes down to self-awareness. And I think this strategy comes into play, however, whether you choose to deal with your anxiety in one way or another. When I was doing research for this presentation, I would read articles, and a number of them recommended distraction as a technique for dealing with scan anxiety. And I think that distraction is a good short-term solution, so it helps calm you down, for example, if you're in the waiting room waiting for the scan, or while you're having the scan, you can do some quick breathing exercises or other relaxation techniques, or listen to music or talk to a friend. But I think that, for the longer term, bigger picture look at scan anxiety, we have to work on acknowledging and accepting that anxiety, normalizing it, because the more we do that, the more we can deal with the core issues that are causing that anxiety in the first place. So it all comes down to doing a little bit of work and trying to understand and take some time to think about what is it in particular that is causing you this anxiety. Is it a fear of recurrence? Are you claustrophobic and you've never had an MRI before? So those are just two, of a number of different types of ways that you might feel about scans. And based on the causes that you identify, you can think about whether you can do anything to lessen the source of the anxiety. So, for example, again, going back to my fear of recurrence, could you speak to your medical team to get an idea of how likely that outcome is? How likely, in your case, is a recurrence? And so that might be something that can quell the anxiety a little bit. If it's claustrophobia, again, could you learn in advance some relaxation techniques for while you're getting the scan? So again, doing that little bit of upfront homework about the cause of the anxiety may help you problem solve a little bit and find some solutions that may not eliminate the anxiety completely, but may dissipate it a little bit. The other important piece of homework is to think about how the anxiety impacts you. How do you react to it? And if we look on the next slide, you'll see that stress takes itself out on our mind and body in a number of ways. This is just a sample of some of the physical, emotional, and behavioral ways that we react to stress. And so you have to ask yourself which of these, and again, this is by no means a complete list, but which of these do you experience? How do you feel and are impacted by an upcoming scan? And so once you do, again, a little bit of trying to recognize what those symptoms are for you, you can try and bring down the intensity of those physical, emotional, and behavioral symptoms by finding ways to cope with them. So for example, if we look on the far right, maybe you are having some sleeping difficulties. When you're stressed, you develop insomnia. So again, how can we work on that? Maybe you're going to try some different techniques to help you sleep. Maybe you're going to, for example, try meditation or reading before bed or taking a relaxing bath. Some people may withdraw from people when they're feeling stressed, and that's always counterintuitive because support can often make us feel better. So maybe if you know your tendency when you're feeling stressed, particularly if you have an appointment coming up for a scan or, for results of a scan, maybe during the week before that you're going to book coffee with a friend or get in touch with a family member that has been helpful in providing support. If it's a physical symptom, is there something that, for example, helps if you have stomach issues when you're stressed? Ginger tea or mint tea or something of that nature. So again, it's trying to do that initial step of problem solving, recognizing how the stress impacts you, and if you can do something on your own to help you bring that stress level down. And so one of the other things you have to focus on in terms of dealing with that stress, especially after you've become more aware of the anxiety, the stress, its impact on you, is starting to find ways that work for you to bring the stress down. And I mentioned a couple on the previous slide, relaxation, reading, that type of thing. So relaxation, meditation, mindfulness, those are sort of standard, tried and true stress management techniques, that may work for you. They're certainly worth a try. And they're techniques that you really have to practice in order to see how they resonate with you and truly if they work for you. And the beauty of the internet now is that there's so much that is available to us for free now. There are a number of apps that have relaxation exercises, meditation exercises, things that teach you mindfulness. So there's apps, there's videos on YouTube. There are courses you can take through Wellspring and other organizations. So, those are sort of the gold standard stress management techniques. But then there may be other things that work for you. For a lot of people, it's walking, it's exercise. They may be the ultimate stress and anxiety buster for you. Getting outside, connecting with nature can really, really help. And it all comes down to, that little bit of self-care. And self-care in any form is essential. The first 5 items on the slide are examples of self-care. The bottom line is that we are better able to deal with stress, with anxiety, when we are feeling our best physically and emotionally. And self-care can include, again, the activities on this slide, or, a bunch of other things. The key is finding what works for you to lessen your stress and anxiety, and also remembering that what works for you today may not work a month from today. So you have to be a little bit flexible in terms of trying new things. Again, it comes down to that self-awareness piece and knowing when you need to change things up a bit. The other thing to remember, and I stress this in all the programs I lead, if you've been on them, is that self-care is not selfish. It's what we need to take care of ourselves, and that enables us to function better in our lives for ourselves and for others. And, it's sometimes hard to give ourselves permission to take care of ourselves. So, granting that permission to yourself may be something you need to practice in addition to practicing the self-care activity itself. Sometimes we have trouble coping with stress, or we feel anxious because we have unhelpful ways of thinking, and that's what we call cognitive distortions. So, for example, some of us may catastrophize, and we always assume that the worst thing is going to happen. So, for example, you say to yourself, the scan is going to show a recurrence. So again, you're thinking of the worst possible outcome. Or you may be somebody that jumps to conclusions. I got a voicemail from the doctor's office. It sounded serious. They must be calling me with bad news about my scan results. Again, we tend to engage in a little bit of fortune telling or mind reading, which isn't particularly helpful, but that sometimes happens. And so if negative or unhelpful thoughts are contributing to your anxiety, you might want to try techniques that help you identify and challenge those thoughts. And it's typically through, you've likely heard of cognitive behavioral therapy, or CBT. And for CBT, you can work with a therapist, or there are, if you Google, a number of online tools that you can work on your own that are self-paced. There are also some online services that were introduced at the beginning of COVID that are offered, some of them for free, some of them have a charge. Bounce Back is one of them. Mind Beacon is another one. And then the other one is Ability CBT. So again, if that's something that might interest you to help you, take a look at those particular resources, or otherwise just Google CBT and see if you can find, there are worksheets, and again, self-guided programs out there. And then, another thing to manage in terms, another thing to mention in terms of managing your anxiety is, and it's not on the slide, but it's this notion that, look at the resilience you have within you, or that you're in the process of developing. Look back at other times in your life when you've experienced anxiety and think about how you got through it. And often we may be able to build what I call an anxiety toolkit from our past experiences, remembering, you know what, I handled something very stressful before. I think I can do it again. So again, that's something you have to work on, but a really helpful technique. This is a great one. Even if you use stress management techniques, it can be really hard, I think we all know, to stop ourselves from worrying, especially if you're a chronic worrier. And when we try not to think about something, we often end up thinking about it more. So if I were to tell you all, you know what, try really hard not to think about a pink elephant right now, you would probably end up thinking about a pink elephant. So again, hard to put worry out of our mind. The worry time technique can help you reduce the amount of time you spend worrying about things that are outside of your control, like scans. And what it does is it gives you permission to spend the time that you aren't worrying doing more productive things. So there are 3 parts to this technique. Number 1, schedule and set your worry time. So try and come up with the same time each day for you to schedule your worry time. Put it in your calendar just like anything else. No more than 30 minutes, ideally around 15 minutes. And it's a good idea, set a timer for that 15 minutes so that you know at the end of the 15 minutes, you're going to stop your worrying time. Even better, schedule an activity for right after your worry time, be it making a snack, watching a TV show, going for a walk. Another helpful thing, although not always possible, is to choose a consistent place to worry each day. That often works. Then what you have to do, and this is the hard part, is you have to postpone your worries at all other times other than your scheduled worry time. So during the day, you're going along and a worrying thought about the scan comes to you. What you can do is have a notebook ready or use a page in your phone in the notes section, and write down whatever worrying thought comes to you. And then in your worry time, when it comes to the scheduled time, you can go back to the notebook and you can do your worrying about what's in the notebook at that time. And after you've written it down during your non-worry time, try to consciously move your attention to something else, okay? And then when it comes to your scheduled worry time, this is part 3, use that worry time effectively. Think about what it is that's causing you stress, anxiety. What about the scan is really, really causing you concern? Ask yourself, is there anything I can do to control it, to change what I'm worried about? And if so, make a plan to do that. And if not, try and bring in some stress management techniques to try and accept it and then let it go. Okay, so again, something really, really helpful to worry, not just in the scan context, but it's also a very, very helpful stress reduction technique. So with scan anxiety, as you know, I've mentioned a couple of times, there's really not a lot we can do to control. We need to have the scan, we need to get the results. But this is an area where knowledge can make you feel a little bit more in control and can actually be empowering for you. Remember, though, with knowledge, you have to be careful. Dr. Google is not the best source of information. There is a lot of misinformation available on the internet. So the best place to start getting informed and being prepared is with your medical team. Ask all the right questions. Learn as much as you need for your comfort level about the type of test you're going to be having. If there's anything unknown, anything you're confused about, get answers so that you're not sitting in a period of worry after the test. Find out how long it will be until you get the test results and how they are going to be delivered. Again, that leaves a little less uncertainty. And then make an action plan for all possible outcomes. And that way you're a little bit prepared for whatever type of news you receive as a result of the scan. Other than your medical team, again, look for reliable sources. So maybe there's an organization that specializes in your type of cancer. Maybe you can speak to somebody through a peer support program, for example, somebody who's had your type of cancer and the type of scan that you're going to be having. So again, the importance of being informed and prepared. And then lastly, support, important for dealing with all types of stress and anxiety in our lives, and something, again, that can help if you are concerned about an upcoming scan. Sharing your feelings with people who support you can really, really help ease your mind. And we've talked about the importance of support from your care team, providing that information that'll make you feel a little bit more certain and secure. And so that support in terms of your medical care. But outside of the medical realm, rely on the support of your family and friends. Let them know about your scan anxiety and see if they can help you find ways to deal with it. Or sometimes it just helps if they listen. If you want the support of those dealing with similar issues, people, again, who have been through your type of cancer, your type of treatment, you can try peer support or support groups. And again, very importantly, if you reach a point that the stress and the anxiety is just too much, don't be afraid to seek the help of a mental health professional. See what might be available through the psychosocial oncology program at your cancer center. Otherwise, your family doctor is a good starting point for referrals and may be able to pass you on to a social worker, psychologist, or psychiatrist.